Hello, everybody, and welcome. This is Margaret Harris at the WHO headquarters in Geneva, and welcome to our COVID-19 press briefing today, this Friday, July 17. Today, among other things, we want to discuss the impact COVID is having on humanitarian work and all those we strive to help. So along with our usual speaker, our Director General, Dr. Tedros, you will also hear from Mr. Mark Lowcock, the UN Under-Secretary General for Humanitarian Affairs and the Emergency Relief Coordinator. As usual, we'll be providing simultaneous translation in all 6 UN languages, plus Portuguese, and you may also listen in Hindi. Note, owing to the way Zoom is set up, you will need to go to the button marked Korean to access Arabic. And now I will hand over to Dr. Tedros. Dr. Tedros, you have the floor.
Thank you. Thank you, Margaret. Good morning, good afternoon, and good evening. Yesterday, I had the honor of being in Madrid to join King Felipe VI and Prime Minister Pedro Sánchez of Spain's memorial for those who have lost their lives to COVID-19 and for the health workers fighting the pandemic. Earlier in the week, I was also honored to be with President Macron in Paris for the Bastille Day celebrations, which were also a celebration of France's heroic health workers. Both countries are good examples of the 4 essential pillars of the response: strong and humble leadership, community engagement, suppressing transmission, and saving lives. And both countries are rightly recognizing the incredible contribution of health workers. WHO welcomes the pay rise for French health workers announced on Monday. The pandemic has shown us that there is no health without health workers. I was especially touched in Madrid yesterday by a speech given by a nurse called Aroa Lopez. I want to read you some of what she said. I quote, "We have given it our all. We have worked to the brink of exhaustion. And once again, we have understood, maybe better than ever, why we chose this profession: to care for people and to save lives. We have been the messengers of the last goodbye to older people who died alone, hearing their children's voices on the telephone. We have made video calls, we have held their hand, and we have had to fight back the tears when someone said, 'Don't let me die alone.'" Ms. Lopez finished her remarks with this appeal: "I want to ask the authorities to defend everyone's health care, to remember that there is no better tribute to those who are no longer with us than to protect our health and ensure the dignity of our professions." End of quote. We all owe health workers an enormous debt, not just because they have cared for the sick, but because they have risked their own lives in the line of duty. So far, about 10% of all cases globally are among health workers. Many health workers are also suffering physical and psychological exhaustion after months of working in extremely stressful environments. To support health workers, WHO has published guidance and training packages on how they can protect themselves. We're also driving research to better understand the extent of infection among health workers and the risk factors for infection. We're also shipping millions of items of protective gear around the world and ensuring health facilities are properly equipped. Although COVID-19 has rightly captured the world's attention, we must also remember it's not the only crisis the world is facing. Many countries, especially in Africa and the Middle East, are still reeling from years of conflict and other humanitarian crises. COVID-19 threatens to exacerbate many of these crises. The pandemic and the restrictions put in place to suppress it are taking a heavy toll on 220 million people in protracted emergencies. While it's too early to assess the full impact of so-called lockdowns and other containment measures, up to 132 million more people may go hungry in 2020, in addition to the 690 million who went hungry last year. Deep budget cuts to education and rising poverty caused by the pandemic could force at least 9.7 million children out of school forever by the end of this year, with millions more falling behind in learning. The economic impact of the pandemic in humanitarian settings can aggravate already dire living conditions, more displacement, food shortages, risk of malnutrition, decrease in access to essential services, mental health problems, and so on. The WHO is working through our 150 country offices to support the response to COVID-19, to support the continuity of essential health services, and to engage communities to ensure demand for these services is maintained. It's also vital that as an international community, we use this opportunity not only to respond to the pandemic, but to build health systems that are more resilient and more able to withstand the impact of health emergencies. The pandemic is teaching us that health is not a luxury item. It is the foundation of social, economic, and political stability. 3 months ago, WHO launched its updated strategic preparedness and response plan, which estimates the resources needed to support WHO's work on the pandemic. But we all know that the impacts of the pandemic go far beyond health, and so do the needs, especially for the poorest and most vulnerable countries. That's why the UN launched the Global Humanitarian Response Plan for COVID-19 in March. Today, I'm honored to welcome Mark Lowcock, my friend, the United Nations Under-Secretary General for Humanitarian Affairs and Emergency Relief Coordinator, to present the Global Humanitarian Response Plan update. The Global Humanitarian Response Plan addresses the immediate humanitarian needs caused or exacerbated by COVID-19 in 63 priority countries with existing humanitarian crises. If we fail to address the wider impacts of the pandemic, we risk an even greater crisis than the one brought about by the virus itself. Mark, thank you for joining us today. Over to you.
Well, Tedros, thank you. Thank you very much indeed. It's great to see you. Great to see Mike with you also, by the way. I don't think I've seen Mike since the day before yesterday. So I'm very pleased to be with you. And I'm very glad also to have this opportunity to say thank you to everyone in the professional media who's been covering the pandemic. I think that by and large, the world has benefited from professional coverage of the pandemic, and I'm grateful to responsible journalists for their role in that. So as Tedros has said, today we published the third version of the UN COVID-19 Global Humanitarian Response Plan. For the first plan in March, we sought $2 billion. The May update was costed at $6.7 billion, and funding the plan we're releasing today will cost $10.3 billion. And you can see that in a way as a metaphor for the explosive impact of the virus. So I will run through the key elements of the plan itself, but first, and perhaps even more importantly, I want to talk a bit about our estimates of the cost of doing nothing in these poor and fragile countries, because COVID-19 and the associated global recession are about to wreak havoc in fragile and low-income countries. And my message today, especially in the run-up to the G20 finance ministers meeting, to them and to other rich nations, is that unless we act now, we should be prepared for a series of human tragedies more brutal and more destructive than any of the direct impacts of the virus itself. Inaction, as Tedros and others have been stating very clearly in recent months, will leave the virus free to circle the globe. It will undo decades of development, and it will create a generation's worth of tragic and exportable problems. But it doesn't have to be like that. This can be fixed with money and leadership from the world's wealthier nations and some fresh thinking. We estimate that the cost of protecting the poorest 10% of the global population from the worst effects of the pandemic and the global recession is about $90 billion. That's less than 1% of the stimulus package wealthy countries have put in place to protect the global economy. Today's plan is an important part of that solution. For $10.3 billion, it will help 63 vulnerable countries and cover the global transport system necessary to deliver the relief. So why should wealthier countries fund this? Well, my office, working with the University of Oxford, has produced the first comprehensive and detailed assessment of the costs of inaction. And I want to highlight three of its conclusions. First, the human and economic costs of increased poverty and hunger. The pandemic risks inducing the first rise in global poverty since 1990. At least 70 to 100 million people could be pushed back into the extreme poverty category. In addition, an extra 130 million people could be pushed to the brink of starvation by the end of this year, bringing the total to 265 million people, a doubling of people facing starvation. Secondly, there's the economic costs of protracted containment measures on education. A protracted school shutdown of 5 months could generate learning losses that have a present value of $10 trillion globally. The average student losing out on 5 months of education could face a reduction of $16,000 in lifetime earnings in present value terms. School closures threaten not only education, but also nutrition, and they make girls more vulnerable. For example, during the 2014 to 16 Ebola epidemic in West Africa, school closures led to an increase in teenage pregnancies of 11 percentage points in Sierra Leonean communities. And thirdly, there's the cost of increased global instability and conflict. An additional 13 countries are projected to experience new conflicts between 2020 and 2022 relative to pre-pandemic forecasts. If that materializes, global instability would reach a new 30-year peak. Conflict is expensive. The minimum cost incurred during an average civil war to both host and neighboring countries has been estimated at approximately $60 billion. Refugee outflows would likely increase. The World Food Programme calculates that for each percentage point increase in acute hunger, refugee outflows increase by 2 percentage points. So let me come on now to the plan we're releasing today. And let me take the opportunity to thank hundreds, probably thousands of colleagues across humanitarian agencies, across the World Health Organization, the World Food Programme, UNICEF, hundreds of NGOs who've contributed to the update of the plan for their work. The main components making up the $10.3 billion are $8.4 billion for country level responses, $1.8 billion for global requirements, including more than $1 billion for humanitarian air transport, getting aid workers in and out, getting supplies in and out, and for our medical evacuation system for medical workers and aid workers working for international organizations who get sick. There's $300 million in supplemental funding for NGOs, in addition to what we've got for NGOs in the country plans. NGOs, in fact, benefit from something like 30 to 40% of all the resources, directly and indirectly, we have in the plan. But we need an additional allocation for them to account for the fact that many of them face acute funding problems now. And we have to keep these crucial NGOs in business because they play such an important role in the frontline response. There's also $500 million for famine prevention. There's a serious risk of multiple famines later this year and early next year, and we need to invest now to prevent that. The plan obviously is only as effective as the funding it receives. So far, we've raised $1.7 billion. I appreciate every country is being hurt by this pandemic, but I do have to say that the response of wealthy nations who have rightly thrown out the fiscal and monetary rule books to protect their people and their economies, their response has been grossly inadequate when it comes to helping the poorer countries, and that is dangerously short-sighted. The massive problem the world faces can be addressed with relatively little money, with a modicum of imagination, and if we park the old rules to reflect today's unique circumstances. Thank you very much indeed.
Thank you so much, Mr. Lowcock, and thank you, Dr. Tedros.
Thank you, Mark.
Apologies, would you like to go say some more words, Dr. Tedros? No, sorry, my apologies for being too quick. Now we will move on to the question and answer session. As I mentioned, both speakers are now ready, both speakers you've heard are now ready to answer your questions, but they are also joined by Dr. Mike Ryan and Dr. Maria von Kerkhove, our regular experts. Now remember, you can ask your question in any of the UN languages as well as Portuguese. Please state your name and your agency and who your question is for. However, as I said, we have so much expertise in the room, someone else may answer. Now, the first person I have on my list is Sophie from the South African Broadcasting Commission. Sophie, could you please unmute yourself and go ahead?
I have on my list is Sophie from the South African Broadcasting Commission. Sophie, could you please unmute yourself and go ahead?
Thank you. My question is directed to the WHO Director, Dr. Tedros. Dr. Tedros, tomorrow is Nelson Mandela's Day. I just want to find out your message to the globe or the world during this time, where we are dealing with the problem of COVID-19. And on the issue of the impact of this pandemic, I just want to find out, the speaker just pointed out that the wealthy nations must come on board. Are you getting a sense that there is political commitment to assist poorer nations in a true Madiba spirit?
Sophie, that question was a bit garbled, but I think you were asking Dr. Tedros and Mr. Lowcock if there is now political commitment to help the nations, the less wealthy nations. Is that correct?
No.
You can do with me.
I really want to. I've just got to. In half an hour, I'll be able to.
Sophie, we'll get back to you and we'll go to our next question. I think there's a family. There's a
piece wasn't made out of cake.
Brilliant.
I got the first one. I can start the first one. The second one was to Mark, I think, about wealthy nations, what they should do. So on the first one, it's Madiba's Day tomorrow, as you said, Sophie, and something that we can learn from his legacy, especially being in this situation, is what he had said, which I would like to quote: "It always seems impossible until it is done." That's very important, I think, considering what we're confronting with now. It gives hope that we can defeat this pandemic. So I repeat again the quote, it always seems impossible until it's done. And as we said before, it's never too late. Anything can be turned around, but we have to push on with the courage and commitment that we have learned from Madiba. That's one. And the second one is, something that I am reminded when I think about Madiba is his commitment to health. He was a very, very strong believer of health for all. Of course, it comes from his belief about equality. So that also is very important. I think when we build back our world, it should be with real commitment to health for all, to universal health coverage. So these are the two things I remember, which are very relevant to where we are now in our situation, from Mandela, from Madiba. And thank you so much, Sophie, for that question. And the second, I'm not sure if Mark had listened, but it's in relation to Mark's statement. Mark, are you there?
Yeah, Tedros, thank you very much indeed. And thank you for what you just said as well. I completely agree with what you just said. So I want to draw a contrast, if I may, between the global response for the 2008-9 financial crisis, where there was good coordination, a real stepping up by the better off countries through the G20, particularly in reinforcing the International Monetary Fund and the World Bank to help the poorer countries. There's an unfortunate contrast between that and what we're seeing now. This is a much bigger crisis, and every country is affected by it. But unfortunately, we don't yet have a commensurate response from the wealthier countries in support of the poorer countries. And our advice is that needs to change if the whole world does not want to look back in 2 or 3 years' time at multiple cascading crises and wonder why we didn't address them better. Because we can prevent the worst still. There's no need for the world to see multiple famines stalking the planet in the next 6 or 9 months, but we won't prevent it unless we act differently. And I think it's timely to flag these issues ahead of the meeting of G20 finance ministers to encourage them to think about what more they can do in the way they acted in 2008-9. So thank you for your question and for the chance to make those points.
Thank you very much. Oh, Mike.
Just one thought on the great day tomorrow. I remember one great quote from the great man who said, "Do not judge me by my successes, but judge me by how many times I fell down and got back up again." And I think that's where we are now with COVID-19 in so many places.
Thank you. We all agree with that. I'll now hand the question to Stephanie from Reuters. Stephanie, could you unmute yourself and go ahead?
Yes. Hello. Thank you for taking my question. It's regarding an update, please, on the WHO advanced mission that's been in China for a week now. The 2 experts in quarantine, but negotiating terms of access and a plan for the wider mission. Do you expect them to return to Geneva anytime soon? And do you expect a wider WHO-led international mission to still get to China, say in July? Or if you have any other details on its composition as well. Thank you.
We're working towards all of those goals. Our advanced team continues to engage with various scientific and health groups and science and technology groups in China. And we're also reaching out now to experts around the world, trying to build and advance a team that can be proposed to go and carry out a later mission to implement research studies and with colleagues in China. It is going to take some time. We're obviously, with the arrival in quarantine of individuals and working remotely is not the ideal way to work, but we fully respect the risk management procedures that are in place. They're in there for everybody's safety and for everyone's health. I think at this point it's unrealistic, given the timelines and given the logistics, that we would expect a full mission to be going to the fields in July, because just in terms of the timing and in terms of pulling that team together. This is going to be a multinational team with many experts from a number of different countries with a number of different expertises. Bringing that team together and then bringing that team into China to work with Chinese colleagues is going to take, just from purely logistics and health risk management perspective, weeks, not days. So I would not like to put a time of arrival for the team, but we are very pleased with the collaboration on the ground, and we would obviously like to see a concrete plan of action with the remaining gaps and the remaining areas that require further study and elaboration to be clearly elucidated and to be pursued by that team with our colleagues in China in due course.
Thank you very much, Dr. Ryan. The next person on the line is Kostas from the Greek television station ERT. Kostas, could you unmute yourself and go ahead, please?
Can you hear me?
Very clearly. Please go ahead.
Thank you for taking my question. You've been talking in recent weeks about how the coronavirus is transmitted through droplets and maybe the air. I would like to ask you if the transmission of the coronavirus can happen in the orophycal way and under what conditions, and what is your opinion on the use of face shields and no masks that we see in restaurants and cafes? Thank you.
So I can start with that question, but I'm sorry, I'm going to go back to Stephanie's question very quickly, because I was just thinking of how she asked the question, where she said, if we are negotiating terms of access. And I just wanted to touch upon that to say that what's happening right now is a discussion between our WHO colleagues and our Chinese counterparts in terms of learning about what studies have been done, what studies need to be done in that collaborative fashion. So I just wanted to touch upon that. Going to Kostas's question about routes of transmission or transmission, thank you for bringing this question up. We get a lot of questions about transmission, and people focus on either droplets, or they focus on aerosols, or they focus on fecal oral, or they focus on lots of different modes. But I think what we really need to be thinking about, and Mike, you may want to touch upon this, we need to think about not only how the virus transmits in terms of whether it's these respiratory droplets or aerosols or fecal oral, but when it transmits in terms of the course of the infection from an individual and where transmission occurs. And that means the setting in which the virus has an opportunity to pass from an infected person to another individual. And that we need to take into consideration the context, the intensity of that contact, and the duration of that contact. And I think we need to start thinking of it in that way, because there are so many different ways in which we can minimize our risk, and in many situations prevent transmission from moving from one infected individual to another. With regard specifically to the fecal oral, there are some studies that are looking at sampling stool in infected patients, and many of those have found RNA fragments through PCR testing, not viable virus or infectious virus, but fragments of the material, of the genetic material of the virus itself. And there are a lot of people that are looking at the possibility of a fecal oral transmission. We haven't seen that demonstrated, but it is something that scientists are looking at. But again, just to reiterate that even though we find RNA in stool samples, it doesn't mean that that is infectious, and it doesn't mean that someone can transmit between the infected stool to another individual.
Thank you very much, Dr. Van Kerkhoff. Dr. Ryan's got something to add.
No, just again, back to the general message from Maria, which I think is important again. It is really important that we continue to pursue all of the knowledge regarding the various potential modes of transmission of this virus so that we can continue to adapt the various control measures. But we also always need to ask ourselves, what does this mean in our daily lives? What does this mean for our day-to-day ability to protect ourselves and protect our families? And I think within this, we need to continually reflect on the settings that we put ourselves in, the situations and the context. Danger is all about context. It's all situational. And being situationally aware, having situational awareness, where am I, what group am I in, is this a safe environment for me, for my children, for my family? Can I reduce the risk of this environment? So it's all about the setting, it is about the duration you spend in that setting, and it's about the intensity of the activities that you participate in that setting. And with you get into a particular setting, a very overcrowded situation in an indoor environment, then effectively all bets are off because so many of the modes of transmission come into play. The aerosol route, the airborne route, the fomite or contamination route. So the more close you are to other people, the more you are inside, the more the activity is intense or involves very close social contact, the more that multiple modes of transmission come into play. So in that sense, it is about you understanding your risk. It is about you managing that risk and being aware of the situation that you find yourself in personally and reducing that risk for you, for your family, for your children, and for your community. It is important, as I've said previously, that governments communicate those risks very, very carefully, and it is also important that providers, authorities and others ensure that those environments are as safe as possible and that the risks are also managed. And we don't know what the perfect combination is of interventions, but what we do know is if individuals and communities are very aware of those risks, very aware of the virus transmission in the area, if the authorities are taking action to ensure that people are safe in schools, safe in restaurants, safe in buildings, and if all of that comes together in an organised and understandable way for communities, in the main, those countries, those areas control this virus. So it's not one thing. It's not